Hello there and welcome to today's video, which is based on hoarding. This is something that's piggybacking off of an article I recently contributed towards within the You magazine on hoarding. So big ups to all those at the You magazine for all you do to encourage and help others to psychoeducate themselves and possibly get intervention to help them, especially in these times. So how do we know when someone is hoarding versus if they just have messy or cluttered households? Hoarding is driven by a very different phenomenon than just excessive buying or impulsive buying. Hoarding can be defined as a compulsive need to accumulate things into their home, and it never quite feels enough. Also, it's quite distressing for this type of person to get rid of these items. It's beyond sentimentality. It becomes like another layer of protection against them and some invisible force they're perceiving in the world, or perhaps a trauma response from the past. So what are some of the causes of hoarding and symptoms of hoarding? Sometimes there is a genetic variability. So if you have a parent or a grandparent that has a tendency of hoarding, there is a higher likelihood that there could be a predisposition. Also, behaviorally, there could have been either one or a string of many traumatic incidences in the past that have caused the person to use a maladaptive coping skill of trying to build an invisible fortress around them. We see that sometimes in obesity patients as well, clients with obesity, where they've accumulated a lot of weight around them to protect them. Sometimes it's very unconscious, against perhaps sexual predators if there was sexual abuse. So hoarding is similar in that sense. So if you think about it, when we see shows with people that have so much clutter that you can't walk through the rooms, you think, how can they live like that? But for them, it's like a fortress. And inside that whole narrative of anxieties, if you try to remove some of those things, is like removing any other safety measure that you yourself have in your life. We all have them to an extent. So if you think of little children, very small, under 5 years old, they often have what we call a transitional object, like a dummy or a blanket. And if you try and remove those things from a small child, they will absolutely throw a tantrum because it is a safety measure. So it has to be a gradual removing or lessening of holding on to those things, which are appropriate developmentally. So if we look at how we identify some of these symptoms in other people, I was asked, do you come across as a normal person? You absolutely are a normal person. You just may display certain things in the public that your friends and family will notice. So even if they don't go into your homes and see the distress when they try and remove things or help you clean up, often people in the outside world, outside of their homes, will present with perhaps obsessive compulsive tendencies, anxiety, depression, sometimes highly perfectionistic tendencies, poor socialization, and things like that. So those are kind of the things to look out for. What do you do if you're a family member and you're observing this? So often what you can see in shows or with families or people that you see these things happen is because of the stubbornness that's being perceived from the family, is they're seeing a person that they think it's just easy to remove these items from the house or their immediate environment. So they get very frustrated. They lose a lot of patience with the person in just saying, just get over it, just remove these things from your home. Is you have to learn to be a little bit more patient and understand that this is separate from the person. So some good tips to look at that is to try remove yourself and the behavior that you're seeing, and rather focus on the person you love. Encourage them, tell them you're worried about them. Then you can start to look at the rooms, for example, that sometimes the possessions are so much so, they accumulate to such an extent that you can't walk through the bathrooms or the kitchen or the dining area because there's so many things. And so you need to focus on clear pathways with the person. Encourage them to start looking for mental health intervention with a professional, because often we look at, as human beings, we look at just behavioral responses without looking at the stimuli as to what is causing the maladaptive behavior. Is a professional needs to come in to try find better ways to cope, better ways to shield against whatever they're perceiving as a threat, that they need to build this thing around themselves. So the most efficacious form of therapy that's scientifically backed is cognitive behavioral therapy, CBT, which challenges thought processes around fear-based responses and what that position may mean to this person. And we ourselves as human beings, even if we're not chronic hoarders, we can always think about why we tend to impulse buy, impulse eat, or impulse say things, is that it's possibly a momentary thing to shield ourselves against anxiety-provoking responses. And anxiety, we know, is a fear-based response on what we perceive the future may be like. Another great intervention with hoarding or any type of anxiety-based behavioral response is living mindfully. This comes from DBT, which is dialectical behavior therapy. So all those things that we learn about and we read about mindfulness and meditation is so good. But if you struggle to still the mind, it's always important to try shift the mind to present-based thinking and try use all 5 senses in that moment when you're feeling so overwhelmed. Is what's happening in your immediate environment. Try and name 5 things that you see and 4 things that you hear and 3 things that you feel in your environment texturally. All of those things are going to shift the mind into a mindful or present-based response. Things like walking in nature, reading, all of those things are mindful-based activities that help us against any fear-based responses from what we perceive may happen in the future, which often we cannot control, so we have to work with that. And also any type of anxiety-based behavioral response, we look at trying to reduce watching the news. So research shows us that chronic watching of news elevates anxiety levels. So often I hear that in therapy with clinical clients is they'll say, yes, but I want to be informed. So if you can try to go towards a need to know basis, as in trying to know just enough to make you feel at ease, that you're aware of what's going on in the environment, but you're not creating a worldview where only bad things happen, because the news is only going to cover things that are not necessarily productive to your day-to-day life. There's a lot of things that are happening in the world and in communities that are really productive and growth forming and full of love and joy that are not being covered. So we need to remember that is the brain is ingesting so many images and thoughts and feelings throughout the day, and over time habitually it forms either a fear-based narrative or one of conservation and care and being quite vigilant but still enjoying your life. So I hope this helped in trying to identify some of the symptoms of hoarding and anxiety-based responses. If you or a loved one feel from this video that there is something to be concerned about, try and not diagnose them or yourself, but rather seek intervention from a professional to get it all double-checked. A diagnosis is a very serious thing, and it takes time with someone in the mental health community in clinical observation to be able to see if there is something that they can assist you with intervention-wise. Also, if you get a diagnosis, remember it's just something you're struggling with. It's not who you are. So diagnosis for mental health professionals is something we use as something to guide our interventions. It's not something that we should be looking at holistically as you as a human being. We all struggle with certain things, and that's all right.